It seems impossible, but it is possible. So my story started when I was very young. In terms of, I had a history of alcohol and substance abuse, and then I was lucky to get in recovery very soon. I was 22, and after a few years in recovery, I wanted to help people in a more professional way. I have an MA in educational psychology, and that's where I got trained into counseling and further in the years. I also did the training of horse therapy. With my personal and professional experience, I also then combined what I see with the horse and what I know with the person, and to see the healing through the weeks here, not only with the horse sessions, but combining what they discovered on the horse sessions, which is very powerful. Basically, it's to try to guide the person into discovering, I would say, the potential that she has, but somehow lost it on the way. I'm a firm believer on people discovering the answers by themselves instead of me telling them what to do. The similarities between alcohol abuse, drug addiction, eating disorder, it's all about the inside. It's all about some kind of suffering, some kind of having experienced trauma, and the answer came through alcohol, drugs, or eating disorder behaviors. The base of the suffering, usually it's the same, and that's what I've discovered. So I've worked 25 years in addictions, and I would say 12 years with eating disorder, and through these years I really discovered it's really basically the same, because what we take care, it's not about the behavior, it's what's underneath the behavior. My heart is on the healing part. It's dealing with people that are in a suffering part of their life, that they engage into a destructive pattern, thinking that maybe that's the best way to deal with it. Yeah, it fills my heart to see that happening, knowing that it's possible. When I see people after they came here and they change their life and they transform it into a more positive one, the first thing I feel really proud about those people. It's the reward of my job is to see that happening. It seems impossible, but it is possible. Life is not easy for anyone, and it is a difficult journey to be in recovery, but it's possible. And there are many people that are examples of it. There's a group session every week, and then once a week there's an opportunity for people to have individual sessions. So each client can have one individual session. I also do relapse prevention block. It's a workshop that we look at how relapse can happen, and we talk about techniques and tools that you can use in order to prevent the relapse. And my message is also, if a relapse happens, you don't have to go completely down where you were. You can just relapse, find yourself in a relapse and get back to the recovery process by asking for help, by not doing things on your own. The most important ingredients to be in recovery, I would say, it's connection. So connecting with people, having people around. Individually, you need to reconnect with yourself, then have positive people around you, and to be surrounded by people that bring out the positive on you and not the opposite.